Hello and welcome to another week of Core Balance Coaching. Today we're going to be talking about the IT band, the tensor fascia latae or the TFL muscle. We're going to talk about their relationship to back pain, hip pain, knee pain, and we're going to look at some really cool images as well. What we'll find is that this is a complex interaction of tissues, and we're going to just get a better understanding of the problem and come to a conclusion that I think will make sense about what the solution should be. If you're having, a situation where you're having knee pain, it might be unexplained knee pain, one of the most common types of knee pain, the most common type of knee pain that affects 25% or more of adults is patellofemoral pain syndrome. And we're going to see the relationship between what we're going to talk about today, the TFL, the IT band, and this extremely common type of knee pain, which I've experienced in the past, and a really large portion of the population has experienced it. So yes, the IT band is involved in this, the TFL is involved, and also the glutes are involved. We're going to talk about that as well. So knee pain is one of them, but hip pain as well. We're going to talk about IT band syndrome of the hip, where we can experience chronic pain on the outside of the hip with, all of this is going to be associated with repetitive motions, running, and, runners are a really common group of people to have this type of pain, but also just normal people. If your body is, significantly out of balance, it may not even take something like running to cause the amount of friction and the amount of pain that would lead to this syndrome. And yeah, we are going to tie all of this into back pain as well, because the body is interconnected, and all of this stuff is just very related. So, quick check on the audio. Hopefully, you guys can hear me okay, see me okay. I'll look for just confirmation in the chat from one of you guys that audio is okay. And I do have to say, I'm very glad I have this microphone, because right now there is a ton of extremely loud construction going on right there, like literally right in front of me outside my window. And you guys can't hear it. I don't think you guys are going to be able to hear it, because this microphone is really good at filtering out that sound. And so I can hear it. A little distracting for me, but who cares? Let's go. All right. Thank you, Kara, for the audio, and Sherry. Thank you, guys. So we're going to do a quick presentation. And then, as always, we will go into the chat, answer all the questions, and also we have the Student Hub Student of the Week to announce, and I think there is one prepared question from the Student Hub as well. So let's get right into it. The IT band. Let's get this out of the way. So today we're talking about the IT band and the TFL. So that's these guys right here. We have the TFL muscle here, and the IT band runs the entire length from the pelvis all the way down into the knee. And so this anatomy here causes problems. The TFL is an actual muscle. Its full name is tensor fascia latae, and the IT band is a very misunderstood tissue in the body. Actually, in searching for images for this presentation, I found a lot of inaccurate images and portrayals of the IT band. Some images, I'm looking at like medical images. Some images are portraying the IT band as a muscle. It's not a muscle. And just the connections, what connects into the IT band looked like there was a lot of variation from image to image, and the way this anatomy works. So I selected images that I thought were the most accurate and we'll get a closer look here. So we're talking about, when we talk about IT band, the full name is iliotibial band. So ilio refers to the iliacus, which is part of your pelvis, this big wing part of the pelvis right here. And it attaches from there all the way down into the knee, or into the tibia. So iliotibial band, or tract is another name for it. And it is not a muscle. It is most accurately, I don't know what is most accurate, but it is kind of in between a tendon and a ligament. And it behaves like fascia. And it does have muscles that attach into it, which make it technically a tendon, but it also attaches from bone to bone, which make it technically a ligament. And it's very broad. So that is why it kind of behaves like fascia. And so it's this in-between tissue of the body that seems to be quite misunderstood. And we're going to try and offer some clarity today. So we've been looking at kind of the front angle of the IT band, where you can see the TFL. And by the way, the TFL is a hip flexor muscle. It's in the front of the hip, and when it contracts, it pulls the leg up, just like any other hip flexor. Let's look at another view. Let's look at a side view of the IT band here. Let's zoom out a little bit. We're going to go here. All right, and so we can see that IT band in white, and then we can see that there are other muscles that connect into it. Look at that, the glutes connect into it, and so they have a factor of pulling on this fascia. I'm going to call it fascia. And then if we look at a front view, or a back view, we can see that the glutes, the gluteus maximus and even the gluteus minimus, do attach into this IT band. And so when they contract, they are not only pulling on bone, they're pulling on this fascia, this band of tissue, and it's having an effect on the body, especially the hip and the knee, and also the back, because everything is connected. So, an interesting thing, and one of the reasons why I like calling it fascia, is this TFL muscle here. If you spell out the full name, it's tensor fascia latae. So it tenses fascia. That's its job. So I'm going to call this tissue a fascia because the TFL, the tensor fascia, tenses this fascia. And what happens? Let's get into the problem. So why does this cause problems? If you know anything about me and my perspective on the body, I look at the body as a synergistic machine. All the muscles work together, and what tends to happen with us is the muscles get out of balance with each other. And when we are talking about the IT band having multiple muscles connecting into it, when these muscles get out of balance with each other, the muscles in the front pulling on the front of the IT band and the muscles in the back pulling from the back, they get out of balance with each other. They're going to pull on that band in different angles. And the predictable pattern in the body is that the front muscles, the hip flexor muscles, are the ones that get too tight. They're predictably hypertonic. And the muscles in the back, the glutes, are predictably hypotonic. They don't get, they don't have enough tone in them in a lot of people. And it causes that muscle imbalance problem throughout the entire body. If we're going to zoom in on this one tissue today, that causes the IT band to get pulled forward. If you follow the arrow of my mouse, it's getting pulled more so in that direction. And this becomes extremely relevant when you're talking about the knee, because if this band is getting pulled more in that direction when it attaches into the knee, guess what happens? This tissue attaches directly into the kneecap. And when the kneecap gets pulled out of alignment, out of its groove, we get patellofemoral pain syndrome. You get a tracking disorder in the knee, and the kneecap is tracking a little bit off center. We can look at this image here of the knee. And you can see the IT band here coming down, attaching into the kneecap. And so the tightness in the muscle, the TFL muscle, pulls on this band and pulls the band tighter, and that kneecap gets pulled over in the groove. It gets pulled laterally. It's lateral patellar tracking is another word for this knee pain, patellofemoral pain syndrome, and the most common cause of knee pain on planet Earth. And I'm very confident about that. That's widely agreed upon. So this kneecap is just not tracking in the center of its groove, and it's pulled a little bit laterally. I've experienced myself, and I'm sure many of you who have had knee pain have also experienced it. So we're going to go back up to the TFL here. This is the muscle we're talking about. It gets too tight. It predictably gets too tight in the pattern of muscle imbalances that the body experiences, and it pulls that kneecap over. Okay, so that's a very common problem. Another common problem is the hip pain when it's just getting too tight up high. This band, this IT band, rubs on a bony structure called the greater trochanter. I'll show you guys that right here. This is the greater trochanter, this protruding bony landmark, they call it here. And that IT band runs over the top of it. And when it gets pulled tight by this TFL muscle that's right here, it just makes it a little too taut, and it's rubbing on this bony landmark and causing friction and pain. So we have the problem, the TFL gets too tight and causes pain in the hip and the knee. So what do we do about it? So one of the things that I teach about as a strategy that I like to use to address muscle tightness is not stretching the muscle, but using reciprocal inhibition. So we can inhibit a muscle by creating extra tone, more activity in its opposing muscle group. And the opposing muscle group of the IT band, what's on the opposite side of the body of the IT band, is the glutes. And so if we can get more tone in the glutes, we can inhibit its opposite. And it's like a rule of the body. It's like a universal law of the body. And in order for one muscle to contract, you can look at my bicep here. In order for my bicep to contract, if I want to contract my bicep and bend my arm, the opposite muscle, the tricep, has to relax, and it has to let go and lengthen in order to allow for this contraction. And so the body does this as part of its operation of how it functions. And that's true not only for active contraction, but also just tone, the resting tone in a muscle. So if we want to decrease the tone in a muscle group like the TFL, in this muscle here, we can increase the tone in the muscles in the back, and that will reciprocally reduce the tone of the TFL. And so back to the same theme that we talk about over and over is getting those glutes more activated, stronger, more tone, more involved in your daily life. It's going to have a beneficial effect. We can explain it biomechanically. It makes sense logically. And so this is the solution that I I believe in is the one that's worked for me. And this is in contrast to, say, stretching a muscle where, actually a lot of therapists, or maybe not physical therapists, but a lot of healthcare people I have heard talk about, stretch your IT band. This tissue actually does not stretch. This, we can think of it in this sense. It's kind of made of this similar material as a ligament, and you do not stretch ligaments. This IT band has too much collagen. It's too strong, too fibrous, where it doesn't stretch. And if you try to stretch it, you're potentially going to cause problems elsewhere. And I remember when I was in physical therapy school, they talked about using a cadaver IT band, and they were able to hang a massive amount of weight on a cadaver IT band, and it experienced no stretching at all. And I can't remember the amount of weight, but it was like a ridiculous amount of weight. Like they were like, you could hang an elephant from this tissue and it's not going to stretch. So there's no point in trying to stretch it. Also, foam rolling is another recommendation people give. Foam roll your IT band. Well, the IT band is like a very flat tissue, and since it's not really a muscle, it doesn't get knots in it. So the foam roller rolling on it isn't really going to do much. But what it will do is it's going to roll the muscle underneath the IT band. So if you have rolled your IT band and experienced, lots of pain and relaxation, or just kind of any kind of effects or results from foam rolling your IT band, it's actually because you're foam rolling this really large muscle underneath it called the vastus lateralis. It's one of the quad muscles. And so that foam roller is massaging that big muscle that the IT band runs over the top of. And in the painful areas are probably trigger points or knots in that quad muscle. So just a little, thing to be aware of. I'm not even really recommending foam rolling the IT band because it's just not the most effective way to address this problem, in my opinion. So that's the anatomy. That's the explanation of the problem and my recommendation on, strategy for the solution. But when you say, okay, how do you strengthen these glutes? Like what is and this picture also includes the blood vessels and nerves, which is a little bit distracting, but what is the technique that we want to use to strengthen the glutes? So you probably already know the bridge is one of the most effective exercises on the planet. There are other exercises that you can do, but there's really none of them really match up to the bridge. And if you have IT band pain or hip pain or knee pain only on one side, then it is worth taking a look at your left-right balance in the body. We've talked about that in recent videos. And if you can, start doing a modified or even full single leg bridge. Okay, so when we're talking about doing the bridge, we are actively strengthening the muscle that is directly associated with this problem, and we are at the same time inhibiting that TFL, which you can see pictured right here. So we'll zoom in a little for you guys here. So there's that TFL attaching into the knee, and we're lengthening and inhibiting it while simultaneously strengthening and activating the glutes. And so this exercise, while it's incredibly effective, it may actually reproduce your symptoms. If you already have irritation going on, the IT band also rubs over this lateral epicondyle of the knee right here. If you see my mouse, there's another bony landmark on the knee that the IT band rubs over. And we already talked about that greater trochanter of the hip. It's going to pull that IT band even more taut when you get into the bridge, because you're lengthening the TFL, you're lengthening the tissues that tug on it. So it may reproduce your symptoms, and that's why I mentioned earlier, you might want to do a modified version of the bridge or the single leg bridge. And I wish I had an image of it, but I don't, and I will just describe it to you. The modified version of the bridge that I recommend is if this person right here were to get a big exercise ball and put it right here, and right in front of where his feet are, and then he or she can straighten their legs and prop their legs up on the exercise ball. Or it doesn't have to be a ball. It could be a couch or a chair. You're laying on the ground, straight, your legs straight, propped up on a chair. So now you have your legs straight, and you are able to bridge up on straight legs because your legs are propped up. That's going to be a much more tolerable way to do this exercise while strengthening, activating the glutes, but not so much irritating the problem. And so that is a bridge modification that you can try. I'll call it the straight leg bridge. And it is going to involve, it's not as ideal because it is going to involve a lot more hamstring muscle into the bridge. So you're probably going to get sore hamstrings from this, but it's better than nothing. And it's definitely a step in the right direction for activating the right muscle group and inhibiting the one that causes problems, that TFL muscle. So I feel like I've been going for quite a while without looking into the chat. So I'm going to look into the chat right now, and we will answer some questions. I know it's been active because I see it moving, and we'll answer all the questions you can, and then we will get into that Student Hub Student of the Week. So hello guys, there you are. Hopefully, I think I can do it a little different, do a little better here. Does that work for you? Works for me. All right. So we'll scroll up to the top. And we see Shane Tucker here. So this is a probably not a TFL related question, but that's okay. I'm just going to go from top down, prioritize people that got here early. So Shane Tucker says, I'm in module 7 and so thankful to you and your whole team for the progress I've made. Hey, that's great to hear, Shane. I see a neuromuscular therapist monthly for massage and to work out tightness. He thinks that keeping my core engaged like I have been is shortening my abs and my front hip flexors. Is there a problem others face? What can I do to keep the front of me loose while strengthen my core? So far, I can't get rid of the hunched forward, rounded feeling. Okay, so this is a really great question. And it's because this is probably a common issue that people face that the program does address. And so if you're in module 7, you've already been through the anchor triad and module, the module 5, I believe it is, where we do standing posture. And if you review that lesson, what you'll see is there is no hunching forward involved in connecting to your anchors. And so we need to be cognizant of the fact that throughout the program, we are learning to essentially bring our rib cage down, bring our pubic bone forward in relation to each other, but the upper body stays open throughout. So So the rib cage comes down like this, but it's not at the expense of hunching your upper body. So we're using our abdominal muscles to just rotate the rib cage down, and that's in relation to the pubic bone. The pubic bone stays forward, and that kind of is a check and balance on compensations. And that upper front anchor pushing away from the upper rib cage keeps your shoulders and your chest open. And so that's another check and balance so that you're not accomplishing one goal at the expense of compensating and creating a problem somewhere else. So that is totally worth reviewing for you, Shane. I would highly recommend actually just going back to module 2 and practicing the upper, the front anchor awareness exercise, pushing away from that, and learning how to open that front of your body while keeping your core engaged. And it's going to be the same thing for the hip flexors. You also in that same module learning how to extend through your hips while doing that same thing, that same core connection. And so in order to extend through your hips, you can't be contracting or flexing your hip flexors. They have to relax and lengthen in order to extend your hips. So this program is kind of all takes that into account, very much so. There's a major focus of the program is this problem you're experiencing, and also just in a general sense, learning how to connect your anchors in a very subtle way. So we're not doing a 50% effort. We're not doing even a 20% effort. It's more like 10% or less. And especially if you're just casually going through your day, it might just be 1 or 2% effort to make that connection to your anchors. And also, you got to think of it like this. You may have experienced this, Shane, where if you're trying to connect to more than one anchor at the same time, the upper front anchor, lower front anchor, and then the back anchor, the harder you try to connect, it almost starts to feel like you're playing tug of war against yourself. And so you're fighting yourself. And so by turning down the intensity and really lowering and just doing a very subtle connection to your anchors, it's a lot easier and you're not fighting against yourself. It's just a subtle activation that's not pulling you down and pulling you into a hunched posture. So definitely reviewing those lessons is going to be extremely helpful for you, and you're going to be able to look at them through a different perspective since now you've already gone through it once. And I can't tell you how many students have said that just going through the program, those lessons multiple times has been a total game changer. Some students go through them 3, 4, even more times and just learning a little new something every time because they're able to have that perspective of already having gone through, farther through the program, and they get to go look back and say, oh, I see how this ties in now. I see why we did it that way. All right, I'm going to re-emphasize this. All right, so that was a little bit of a spiel. I'm going to move on to Anne. So that was it. So Anne says, CBT is an excellent program. I'm on module 6. Do you recommend minimalist shoes for like Xero brand? I have intermittent low leg, what is that? LLE, and foot radicular pain, I think associated with my left SI and back issues. Left lower extremity, is that what it is? Yeah, that's what it is. So I do recommend minimalist shoes for people that are ready for them. I think that jumping into minimalist shoes from a highly supportive shoe is a bad idea. And so we should work towards minimalist shoes, but you have to do it gradually. And I mean that. Like, I'm not just saying that. I mean, like over a period of many months, because your feet and your whole body can react very poorly if you just jump into a minimalist shoe. Xero is a fine brand. Yeah, I have Xero shoes myself. My wife has Xero shoes. I also like Lems. I also like Lems is probably my favorite, and I also like let's see, Ultras are a little bit minimalist. And I have a whole video on that, actually, of all my favorite brands. So if you go to the channel and you just search shoes, you will see all my favorite minimalist shoe brands in a video. Adam Sheehan, all right. Checking in from Minnesota. All right, good to see you, Adam. Question, my body has been in protection mode for the hip hinge movement for almost 2 decades. My brain immediately goes into alarm mode. I'm working on calming and reassuring to forego that reactivating fear mechanism, but my brain tries to go into protection mode out of habit. I've tried hand on the hips with little success. Any other modification I can try to help ease into the movement of the hip hinge? This is also a really good question. So I understand what you're saying, because there is a pervasive fear of bending forward in people who have had a long history of back pain. We start to avoid that motion, and the brain makes that association with bending forward and back pain. And even if you learn a healthier way to bend forward, the brain may continue to make that association. So yeah, we have to break out of that, and it's not an easy thing to do. So what do? One thing that we can do is we can just start very, very slowly and very minimally, and just do tiny little hinges and stop there and call it a win and move on with your day. Say, all right, my brain successfully, confidently did tiny little mini hinges, and I did not hurt myself, and I'm going to walk away from this going, that was a win. And so don't try to push it to your threshold that day. And then the next day maybe a little bit more. And so you can progress that way over a long period of time to just teach your brain that you can do it without hurting yourself. So that's one strategy I definitely recommend. Another thing to take into account is that as your glutes get stronger in this process of going through core balance training, bridging daily, doing all the other things that we're doing to get those glutes more active and stronger in your body, it's actually going to become easier and safer for your body. Your body's going to just naturally feel safer because it has that support of those massive hip hinge muscle groups that it needs. And so that takes time. Building muscle, building strength does take time. And so if you just stay persistent and continue to do that, you're not going to have to do as many tricks on your brain, because it's just naturally going to get easier. So that is just the other thing I wanted to recommend. So gradual progression, like super duper gradual, and also just keep going and be persistent. And as those glutes get stronger, that will be a victory. Sherry, hi, Dr. Ryan. Hope you and your family are well. Thank you, Sherry. I'm thinking jumping back into the program to try and complete the modules. I got stuck at module 8, wondering if I will be able to access the live streams that I missed while I was taking a break. Yes, all the live streams. So I'm not sure when you took a break, Sherry, but I will tell you that all the live streams are now posted every week in the new student hub. So we have a new student hub. I don't know if you saw that, but it's definitely an upgrade from the old one. And we have a whole page where all the live streams are posted. So definitely check those out. And I'm glad to see that you'll be coming back to finish what you started. That's fantastic. Miss Tran, hi, Dr. Ryan. Can you pigeon pose now, or you don't think it's necessary to practice the pose and face the risk of injuring your SI joints? What movements do you initially introduce in your healing journey? Wow, I'm loving these questions. These are all really great questions so far today. So do I do the pigeon pose? I don't do it because I don't think it's necessary, but can I do the pigeon pose? Yeah, I have done it recently since healing up my SI joint. And I don't think that I injured my SI joint. But if I felt like my SI joint was kind of iffy, like maybe I had done some things recently that kind of just tested it, and then I did the pigeon pose, I bet you that I would experience pain afterwards, like a setback type situation, because it is a very extreme position. But yes, you can build up your SI stability and heal those ligaments enough to be able to do that pose again. I don't necessarily think it's not a necessary pose to live a normal functioning life and be able to do everything you want to do. You don't need that pose to do that stuff. The only benefit of the pose is if you are a very dedicated yoga practitioner, and you want to get deeper into your practice and be able to do deeper poses. That's otherwise maybe you're a gymnast or some kind of athlete that requires extreme hip mobility. Those are the applications. Hopefully that helps, Sherry. I'm currently going back through the old live streams and taking notes on the ones pertinent to my specific issues. Thank you for all the wonderful content. Thank you, Sherry. We just can't say enough how much we love seeing you anywhere and everywhere around the program. You're a major part of our community. So thank you, Sherry. Ms. Chan, also, do you think farmer and suitcase carry are better alternative for plank, side plank? I see the two carriers exercises usually recommended by other therapists. So they're not a better alternative. They're a different exercise because gravity is acting on you in a different plane. And so they're going to have different benefits and different challenges for the body. I don't think they're better or worse. And I think it's an excellent complement to the side plank. So if I were to pick one or the other, I'd probably pick the side plank because I think it has a more expansive effect on the body. But farmer carry, suitcase carry, they're probably more functional. They're much more applicable to our normal daily life that we carry suitcases around. So yeah, maybe, I don't know. I go back and forth. Now I'm thinking maybe the farmer carry is more applicable, or the one I would choose. So both are beneficial. Yvonne, thank you so much for CBT. It has improved so many things in my life. I'm reading Peter Attia's book, Outlive, and wondering two things. All right. Thank you, Yvonne, for the positive comments. And let's see what you're wondering. Is our get fat the same as intra-abdominal pressure? Very good question. And are we doing a form of DNS, dynamic neuromuscular stabilization? So the answer to the first question is not really. The get fat concept is kind of a check to make sure that your deep core muscles are activating. And when the deep core in particular muscles, the obliques, the TFL, sorry, gosh, I'm on TFL, the transverse abdominis, when they contract, they expand, especially the obliques. And so your muscles are becoming taut rather than being relaxed. There's going to be a little expansion in the core. So it's the bracing effect. And so that's all the get fat concept is to just to make sure those muscles are expanding and getting and participating in whatever you're doing. And you want to check the sides because we're not focused on the center rectus abdominis. We're focused on those deeper muscles that you feel on the sides. So the intra-abdominal pressure is something that would not result in expansion because actually we're trying to resist expansion with that intra-abdominal pressure. If the core expanded, that would reduce the intra-abdominal pressure, if that makes sense. So we have we have a certain amount of pressure that we have in our abdomen by inhaling our breath into this closed system, this chamber, this cylinder. And if we were to expand that cylinder out, like blowing up a balloon, maybe not like blowing up a balloon. I'm having a hard time explaining this, but actually the way to increase pressure would be to contract the core and make it smaller. And so I don't know. I don't actually like using an absolute in my answer here. So I'm going to kind of take back my answer. Maybe a little bit of the expansion is from the intra-abdominal pressure, and a little bit is also from the muscles becoming taut and expanding that way. So there's your answer. A little bit of both. Now you had another question here. Are we doing a form of DNS, dynamic neuromuscular stabilization? Yeah, I mean, there's a lot of overlap in core balance training and DNS. I don't know if I would say it's a form of DNS because I never did DNS. I never took the official training, but the major overlap with DNS and core balance training is that we are modeling after infant and baby development. And so, yeah, we are, the goals are very similar with DNS. Stabilization, that's one of our goals. We are addressing the neuromuscular system, and I don't know what they're referred to with dynamic, but movement. Yeah. So is it a form? I'd say no, but is there a lot of similarities? Yeah. Is there a lot of overlap? Yes. Asti. All right. There's the answer there. Greg Pietras. I'm in module 4, day 5, and it seems to be dragging. There's a lot of review and practice. Seems like a waste of a week. Also, you never state how long to do these for. Is this due to the 10% rule? No. No, it's not due to the 10% rule. So let's address the first part of your comment, Greg. Okay, there's a lot of review and practice. So yeah, I believe that the review and the practice is extremely important to be able to grasp this stuff. And I don't know, I wouldn't call it a waste. I think the repetition over time is the formula to have success. And so part of it is to encourage you to continue practicing these things. And if you're, working on your body, practicing exercises, getting better at them, I don't consider that to be a waste of a week. If you are looking for a new lesson every day, that may be more interesting, or maybe feel like you're getting more content. But sometimes more is not better. I wouldn't consider it to be better if I just gave you a new exercise every day and said, here's 75 different exercises to master. I think that the strategy of this program is to really zoom in on what's important, which is core connection, and master that. Become just a master of one thing and be able to apply that to the different functional movements of your life. And so, yeah, that's my approach. And, we are working on more lessons to add to the program as we speak right now. So there will be more added very soon if that's what you're looking for. So the reason how long, I never state how long to do these for. Well, I do. I state to do everything for 5 minutes. And so every exercise, and you can see in your daily routine every single day, it says do this for 5 minutes. And so that's how long to do them for. What I don't state is do 3 sets of 10 or do 3 sets of 15. And that's because everybody's at a different fitness level. And I've actually put out an entire stream on this topic of why I don't do that, because it's very important that people don't get stuck in that like, I don't know, that is a very unpersonalized, unbeneficial strategy for doing exercises. What you want to do, and I'm not going to repeat this whole stream that I did on this, which was not that long ago, maybe 2 months ago. You want to do a set until you experience fatigue, and then take a break and do another set. And that's the best way to get benefit from exercise, is to experience fatigue. Now, everyone's going to experience fatigue on a different number of reps. And so you find that number that gets you to fatigue and take a break and do another set. And you do that process for at least 5 minutes. And that's how you're going to get maximum benefit from exercise. Thank you for the constructive feedback, Greg. We always appreciate that. And we will take all of what you said into account and how we can better the program for everyone. All right, Arcane Jill. Hi, a while back, one of your dream team, Kara or Melody, recommended a book in addition to the ones you have listed. I can't find the message. Any way to find which book? Thank you all. Arcane Jill, I don't know if you are aware, but we have a bunch of books listed. Oh, you already said that. In addition to the ones I have listed. So hopefully Kara looks like she's on the stream, or Melody will be able to find that, because I don't know which book they recommended at all. So I'll take a look. I'll ask about that. I'm sure one of the dream team is watching and hearing me right now. So let's look into that and get back to Arcane Jill. Lori Lund, last year I did a long hike most days. Had a lot of up and down, and I was able to handle all that okay with the help of diclofenac. The last day was one long climb followed by one long descent. I was having to take big steps up, and as I kept doing them, I started getting a pinch in my outer hip. Not sure if this was TFL or part of my glutes. Lori Lund, I don't know if you're still here, but I didn't mention this in the presentation, but IT band pain is often reproduced by going downhill. And so if you mentioned you were doing a descent and you were getting pain on your outer hip, that is in alignment with IT band syndrome or IT band pain that is rubbing over your greater trochanter in your hip. And it all ties in, it all makes sense to the anatomy, because when we're going downhill, we are using our hip flexors extra heavily. So this TFL muscle is having to contract extra heavily when you're going downhill to slow you down. So you don't end up running downhill. If you're trying to walk downhill, you're actually slowing yourself down, and you're using your hip flexors to do that. And so these muscles become extra chronically contracted if you're doing a long descent, and it can create and reproduce IT band pain syndrome. It all ties in together, and this stuff all just makes sense. It's a very logical problem that happens. So very great connection you made there, Lori, and if you're still here, yep, I will confirm that it's very likely. Dakota, my therapist worked on my hip flexors and now my hip hurt worse. Maybe he went too much. Yeah, that's very possible. There's always the possibility of doing something too much. Thank you guys for the audio confirmation. It kept getting worse to where it felt like a snake bite or something if I brought that hip into full extension. Yep, so that's going to be consistent. The longer you go, the worse it gets. It's a repetitive trauma injury. It's that friction every time you go. And it is most likely, as you say, I found that if I kept my hip flexed a little as I climbed, I was able to avoid the pain. Yeah, climbing, you'll be able to avoid the pain for sure. Could this be explained by tight TFL IT band? Yes, absolutely. Not absolutely, nothing's absolute, but yes, definitely possible. Glenn Wasmer, good afternoon. All right, so we got the last question mark there, and then we got a bunch here. So at the last question mark, what I like to do is I like to switch gears. We're going to do the Student Hub Student of the Week, which is right here. Beth G, congratulations. You are our Student Hub Student of the Week. We are recognizing you for your actively participating in the daily challenges. Daily commitment is the #1 factor for success in the program, and your involvement in the challenges is a great accountability tool. So great job, Beth G. Yeah, we love people doing the challenges. We know that that means they're participating. And so you are setting a good example for other students and getting the benefits of daily commitment yourself, Beth. So great job. We're going to honor you by adding a month to your membership. You have to do nothing. We will add it from the back end. And congratulations. And I hope you inspire other students to do the same. So I believe we had, no, maybe not. It looks like that question was removed. So we will go back to the chat and see what we can do. We're almost at an hour. I'd say I started late today, so in 10 minutes, we'll be at an hour. All right, Kaylee Sweeney. I've been told by one PT and a few chiros that one leg is longer than the other, the right leg, same side. I get SI joint pain and more sore leg muscles. I've had no injuries. Isn't leg length discrepancy uncommon? So this is an interesting point of view. I have the opposite understanding in that a leg length discrepancy is quite common in the sense that most people have one. It's just that most people's leg length discrepancy is very minimal, less than a quarter inch, or even less than an eighth of an inch. But there's always like there's sometimes slight differences in our legs, and most people just live with it and don't even notice it. But it looks like somebody down below says the same thing. Dr. Ryan says a quarter to a half inch is relatively common. I'd say those numbers are too large. I'd say less than a quarter inch is relatively common. And if I said up to a half inch in the past, I might have misspoke there, because I think a half inch leg length discrepancy is going to be more felt, more noticeable in the body, and probably be less common. Now, what is the other part of your question? What I would recommend, Kaylee, is to take a look at the recent streams or videos that we've put out about left-right imbalances, where in one of them, I specifically talk about how leg length discrepancy may not be structural. It may actually be functional and related to uneven hips, and also other factors such as the Q angle of your hip or knee valgus position, where it can create a functional leg length discrepancy, but it's not actually a structural difference in the length of your bones. I think that is a more common problem and is very difficult to diagnose. I mean, I would not feel confident diagnosing that in a person by measuring and doing tests. Is a very difficult thing to differentiate between structural and functional without having a very advanced type of imaging. Yeah. I mean, an X-ray could do it. So you don't really need advanced imaging, but it does require skill to be able to read it. All right, Kit B, we've got says, hi, Dr. Ryan. I'd like to know if I can start my weight training, band training workout. In the past, deep squats have aggravated my SI joint pain, so I'm currently using exercise ball to do squats. Yeah, I believe that you can start for sure, no problem. And what you want to do is you just want to gradually work your way into it. Don't jump into where you were when you were, causing or having the problem. If you've been in the program and you've been building yourself back up, it's probably time to get back into that stuff and just gradually, ease your way in over multiple workouts, and be patient and test yourself. All right, I'm going to go at this level, 50% today for 50% intensity, and see how my body reacts. And then wait for a couple of days, maybe 2-3 days, see how your body reacts. And based on that reaction, that's going to guide your next workout. The other thing I want to say is that deep squats do aggravate your SI joint, but you don't need to do full deep squats to get benefits. You can, and an exercise ball is a good one, but you can do 90-90 squats or even a little deeper than that without going all the way down, touching your butt to your heels and causing a problem. So there's a lot of room to work with there without irritating the SI joint. Christy Bainey, hi, just want to say a huge thank you for helping me, helping my SI joint stabilize and giving me a really great week and out of pain. Awesome, Christy. Oh man, I'm loving the positive feedback today and a lot of gratitude. So thank you, Christy. You're the one that you deserve all the credit because you did the work. I didn't do anything, for your body on the other side of this computer screen. Just a little education, and you put in the work, so you deserve the credit. Glenn Wasmer, I'm finding the resistance bridge very comfortable. Oh, that's awesome. Hope you meant to say comfortable, because if it is, then I'm happy to hear that. I know my IT band is tight. PT had me doing a stretch where I put one foot behind and to the side of the other, then stretch over to the side of the foot behind. Is this a passive stretch? Oh, I don't see the rest of your comment, JT Thompson. So, oh, there it is. PT had me doing a stretch for IT band. A lot of what she had me do didn't feel right for SI pain. I stopped going after finding your program. You make more sense. All right. All right, so I'm going to go back up to your top one there. So as we talked about in the presentation, maybe you posted this before I said this, but IT band does not get tight. It does not stretch. It does not get tight. It's just a static tissue, but the muscles that attach into it, most likely the TFL, is what gets tight. And so it's important to know that. So we don't stretch the IT band, even if the therapist is stretching it. They might need to research the IT band a little more. What you would maybe stretch is the TFL, but I personally don't address that muscle tightness by stretching it. I think it's a much more effective method to address it by through reciprocal inhibition, by strengthening the opposing muscle group, those glutes. So thank you for sharing that, JT Thompson. Angela Carter, the what informs, the why transforms. Awesome, love that. John Paoloni Jr., thank you for all your videos. I love your simplistic explanations and very effective remedies. Keep doing what you're doing. Thank you, John. I really appreciate that. Karaoke, I am on Module 4 Day 5 as of today. However, the past 3 to 4 days, I have been experiencing fairly strong butt pain. This is something new. Am I doing something wrong? How can I get rid of it? So butt pain could be a number of things, but if it's biomechanical, your butt ligaments are your SI joint ligaments. Let's see if we can find an image. So here we are. This is the back of your pelvis. This is where your butt is, and right in underneath all that tissue is ligaments, and by tissue, I mean your glutes and fatty tissue of your butt. And this is what can get painful. And so it may or may not be that. I would need more information than what you gave to really know more, because you just said fairly strong butt pain. So it could be the ligaments, or it could be something new. You're in Module 4 Day 5, and Module 4 is the back anchor challenge, I believe. And that actually can irritate the SI joint. If you go too far, too strong, too aggressive, that exercise could irritate the SI joint. And so you want to tone it down. Don't extend your legs as much in that Module 4, in those Module 4 exercises, because you might be irritating the SI joint, and you really want to stay connected with your anchors as a priority. So it may be, it's most likely an association with what you're doing. and I would change your approach. And usually it's going to be turning down the intensity or the amount that you're extending your legs, especially with that exercise, and focusing more on the core connection, not so much the leg movement. Okay, Dakota. So I just started having sacroiliitis after an aggressive chiropractor adjustment. I have pain on hips now and knee pain. They worked the hip flexors and glutes, but the pain got worse. What happened? Sacroiliitis. So that's just SI joint inflammation. And a chiropractor adjusted it. Ooh, I highly recommend you watch the YouTube video that we're publishing tomorrow morning. We're putting it out tomorrow morning. Highly recommend it. It's all about this and causing SI problems with adjustments. I have pain on the hips now and knee pain. They work the hip flexors and glutes. So, it's possible that they over-adjusted, they manipulated it a little too hard, and that there was a little bit of injury to the tissues. And what I mean by tissues is all these ligaments. They don't like being stretched. They don't like being adjusted. I'm about to repeat everything I say in the YouTube video that's coming out tomorrow. So when that happens, the body will react with pain and also muscle tightness, as in an effort, or the muscles all around the joint that's injured will tighten up to try and protect it, creating a body brace, a natural brace within your body. So that's my explanation of what maybe happened. Resistance bridge. All right, Glenn. I think that's in reference to right here. Resistance bridge, very comfortable. Yep. Cool. Patrick Pellegrino. I'm starting to think I have pelvic tilt, not just a lateral shift of my torso. I can't do the single leg bridge. My leg is too weak. All right, so modified single leg bridge would be just gently, not gently, but just in a very minimal way, reducing the weight off of one of your legs. So let's just look at this image here. So say this person were to not completely lift this leg up, but just slightly reduce the amount of weight on it. So have a subtle intention of unweighting this leg, but maybe still 50% or 25% of the weight is still on this leg. And now 75% of the weight is on this other leg. So that would be a modified single leg bridge, just in the sense that you're maximizing your ability to carry weight on one leg. And it's this other leg is kind of like the spotter. If you're in the gym and you have a spotter helping you lift weights, you're controlling the amount of weight that's going into your other leg with the spotter leg. And so that would be a modified single leg bridge. And you can work your way up by reducing that percentage down to zero eventually over time and being able to do a full single leg bridge. But I think this is a very good assumption that you are starting to think, Patrick. So I support that. General question, if able, either or single leg progressions have become undoable. Tried to back down to the bridge march, but I'm not able to comfortably. So this would apply to you. Everything I was just talking about would apply to you as well, Glenn, is that you're really going to want to tone it down, just go back to the basics for a little while and to gradually work back up to this modified single leg bridge, and be patient with it, because this stuff does take time. It takes time for the body to make these adaptations that we're trying to make. We're trying to make rapid adaptations to the body that may have been taken 10 years to happen. These imbalances may have taken decades, and we're trying to reverse them in 3 months, which is very, very rapid. So sometimes we overdo it. It's a very common thing, and we got to just give the body a little break, go back to the basics, and then reintroduce more gradually. And those modifications are a really good way to do that. All right. I think I already read this one. Yep. Thank you for sharing that. And then we are down to Patrick Pellegrino. Can't get my TFLs to release. Yeah, that's a tough one. And it is, a part of this problem is a pattern issue where we tend to overuse this muscle in our daily life movement patterns, and breaking out of a movement pattern is a very difficult thing. It takes a lot of mindfulness. And so, you can try to help it along with massage or deep tissue, muscle release type techniques. But ultimately, it's going to be a matter of creating muscle balance, addressing those glutes, getting them more active, and then learning how to move that movement pattern thing with more glute and less hip flexor. I don't really focus on zooming in on your TFL. It's part of the whole hip flexor group. So more hip extension, less hip flexion in our walking and our daily movement. Shannon, I just lost my place. There we are. All right. I don't know if you guys can hear that, but there's so much banging happening right out my window right here. There's like a big piece of machinery 30 feet away from me. I can hear it. You guys probably can't. All right, Shannon, if I feel a pulling on the outside of my knee when I move into full bridge, is it better for me to do the straight leg bridge or just keep the height of my bridge low enough that I don't feel the pull? I would do both, Shannon. I would kind of alternate between both and just kind of address it at all the angles that you can without worsening your condition. I don't know that there's a better or worse in this situation, but approaching it from all angles. And I like that you already thought of one way to address it by doing a lower form of the bridge. So any modification you can think of is what I support. Crate studies. Hi, doctor. After the lower back adjustment was done by my chiropractor on, well, you must be from any other country than America. So February 29th. From that day, March to March 9th, the pain gradually subsided. Now when I stretch or arch my back, I hear that pop sound. All right, let's see if there is another post from you. I don't see another post. So yes, so this is a thing that happens. This happened to me. I experienced an injury to my spine from a chiropractor and led to an instability. So it's going to be a journey for you, a journey towards stabilizing that pop, that potential maybe instability that is there. So a journey towards stability, and that uses your core muscles to do that. Glenn Wasmer, so glad to hear going back to the previous modules is doable. It just makes sense to me. Yes, that is right, Glenn. Fully support that. Like couldn't say it enough. I hope everybody does it. I have had former students come to me and say, how could we work in going back to do the previous lessons as part of everyone's normal program because it's that important? I'm like, yeah, that'd be kind of weird to have people go back to the beginning as part of the program, but maybe incorporating new lessons that involve the old stuff, because it is really that important to review that stuff. It's just a thing where you've already gone through a bunch of stuff, and so you go back to the beginning and you have a totally new perspective, and you're more able to learn what I'm teaching the second time around. It's kind of hard to explain. Semper, just had my worst SI joint pain. I started to do the bridge as well as a gluteus medius exercise. That's interesting. Gluteus medius exercise. It seems that I have massively overdone these exercises, and now I have IT band pain. What can I do? So the first thing I recommend, Semper, is to take a break. Like, give your body some time. And then I'm not sure if you're in the program or not, but I would recommend, if you are, going back to the basics. Just like Glenn said right above, it's a very, very beneficial thing, especially if you get a setback. The body tends to resort to protection mode when you're in a setback, and these muscle imbalances get over-exaggerated, over-emphasized. And when you get back to the basics, get down on the floor, connect to your anchors, it can remind your body that you're safe and remind your body what those healthy connections are that we've been learning. It can really help you get back on the right track. So that's what I recommend, is getting down on the floor and connecting to your core. And when you get back to doing these things, you want to learn from that experience of massively overdoing it. And you want to turn down the intensity significantly and turn this negative into a positive through allowing it to give you body wisdom. And that's what I like to call it, is body wisdom. You've learned something about yourself. Thank you for posting the video, Asti. And where are we at? We're at 1:15, so about an hour and 15 minutes. I'm just going to do a check. I feel like we're still getting posts and I'm not catching up. So I'm going to set a kind of like another 5 minutes. I'm going to go another 5 minutes and do what I can. And then we're going to have to sign off for the day. So we got Mortal Medicine. What's up, Ryan? Thanks for the stream. You're very welcome. I've developed hip pain with numbness and tingling in my right leg. Quadratus, glute, very tight. SI looseness, can't stand or walk. What's the first step? Ooh, I like how that was very specific. What is the first step? First step is, for me, it's always educating myself, educating yourself on the problem. So you're here today, you're taking the first step now. So what is the second step? I'm going to answer what is the second step, because you're already doing the first step. Second step is going to be probably finding the floor, getting really comfortable with it, getting down on that floor and letting your body melt into the floor, and then start from the center. I would say, sounds like you got multiple things going on. You talk about quadratus. I don't know if you're talking about QL, quadratus femoris. That would be I think what you're talking about is quadratus femoris, but maybe not. Glute tightness, hip pain, numbness, tingling. I think you got to start from the center. So we got to start with the core. And, if you're in the program, that means back anchor. I would back anchor, I would front anchor, and just do that for a day. And then see how that feels. Usually you're going to feel better after that. And then you progress from there. But when you have a big setback, I was just talking above about going back to the basics. Lisa, I'm a newbie and doing the trial, but I'm officially going to join the program. Great to hear, Lisa. I've learned a lot, and most of it different from many providers I've been to. Hopefully I can get some relief. I believe you will, Lisa. Welcome to the program, and we're super happy to have you. Hope to keep seeing you on these live streams. Keep asking questions. I'll be here for you. I have been waiting. This is from Effie Souls. I've been wearing Ultra shoes for several years. They're a zero drop, but not minimalist. This is not the kind of shoe that you recommend. So Ultras are minimalist in 4 senses, but that 5th sense is what makes them not a full minimalist shoe. So 1, they're zero drop. That's huge. That's massive. 2, they have a wide toe box, which is, oh, look at those balloons that just popped up. That was weird. Wide toe box, minimalist. 3, they have very low amount of toe spring, which is where the toe lifts up in the front. That's a minimalist style. 4, what is the 4th one? They're very flexible. So if you can take the shoe and you can fold it in half, and it is very flexible like the foot. The 5th element that they are lacking is that there's a lot of cushion in an Ultra shoe. And so they're not very thin sole. And a lot of people like that. So I don't really mind it very much, especially if you're doing long hikes or backpacking trips, because we sometimes we need that cushion to avoid that repetitive pain, like conditions like metatarsalgia or heel pain on the bottom of our foot if we're going to be going many miles. So I like ultras for backpacking or long distance stuff. That's where they fit into my minimalist repertoire. But yeah, there are more minimalist shoes like Xero or Lems, or there's a lot of other brands out there as well. Dakota, I have SI joint problems and my chiro adjusted my mid back and the pain is unbearable on the mid back. I feel that it shifted. It makes a sound and now and then. It makes a sound now and then. What should I do since for SI hip and knee pain? Woo, that's a tough one. I'm sorry that you are experiencing unbearable pain in your mid back. That's not fun. This is another really big question that I'm not going to really be able to give like a super comprehensive answer, but what I will say is it sounds like you've got pain above and below your center, your core, your mid back, your SI, your hip, your knee. There's a major imbalance in the body going on there. My wife said not to use global imbalance anymore. So a whole body imbalance that's very commonly leads to problems in multiple parts of the body, and neck, knee, foot. I felt this way, that my whole body was just like falling apart. Well, that's a whole body imbalance. And so you start in the center. So core out. And so that is my recommendation. And that involves getting down on the floor. Now, I just see Wes Pack just said, friendly reminder, my question was skipped. This tends to happen from stream to stream where people feel like their question was skipped. But if I were to scroll up all the way through, I'm not going to see your question, Wes. So I don't know what it is, but some people, their question doesn't show up on my chat. Oh, there it is. I missed it. All right, Wes, here we are. So I'm wrong. Here we go. Westpac, I joined the program while recovering from L5S1 microdiscectomy. I wanted to see what advice and wisdom you had for minimizing pain while driving. That seems to flare me up more than anything else. Ooh, yes. I've talked about this in the past. Because I skipped your question, Wes, I'm going to give a little more time and effort to my answer with this one. So driving is something I can relate to as an activity that causes me problems, causes my body problems. And when I drove to Utah and back this last summer, my body felt it. And it was a rough couple months, I think, afterwards. I even did a whole stream on my setback. And so what recommendations do I have for driving? So besides the obvious, I will state the obvious, frequent breaks. And I don't know if you're doing long drives or just lots of short drives that are involved going to work back and forth every day, and it's not really worth taking a break to go to work. That is a possibility. But if you're doing longer drives, lots of breaks, like just pull over just to take a break, not like only during the times where you need to go get gas or go to the bathroom, but pull over just to take a break. And when you do that, walk around. Stretching before and after, doing the bridge, at your house or your office or whatever before and after is really beneficial. There is a standing stretch that I've recommended in the past. And, the thoracic It's a thoracic stretch that I recommend. I guess I just have to demonstrate it right now because I'm talking about it. Where are we here? So this stretch right here. So if you're standing, you put your hands, you could do it on the hood or the roof of your car. Just go down like that. And let your thoracic spine drop to the ground. That's a really beneficial one, just to kind of open you up. And so there's that. If you do stop to go to the bathroom or fill up gas, also walk on those brakes. So brakes. Another thing is seat positioning. You want your seat as far back as you possibly can while driving safely. And then for the backrest, you want to have it more forward, actually, surprisingly more forward. And that's going to help with your upper back and neck posture. But you also want to add some variety to that so you can change it on the drive. So bring it back a little bit, bring it back a little further, bring it forward, and getting that variety on your drive. And you can even scoot your seat forward and back. The variety is going to be extremely beneficial because the driving is a repetitive problem. It's repetitive trauma. We're doing it so often and every day, and using that right leg on the brake and the gas pedal. So we just want to change the angles by moving the seat and giving variety. Another thing is how can you drive less? Is it possible to get an e-bike and get to where you need to go and reduce your driving by 50% or 75% by using an e-bike? And if you think about cost of an e-bike, I am a firm believer that you actually cover your entire cost of an e-bike by using it instead of a car. You recover that cost over maybe even just 1 year. And so that's been a recent change in our lives and our family here. And I'm using the car maybe I've reduced my car usage by like 80 or 90%. I live in a relatively small town, so I can get almost everywhere on the e-bike. Almost feel like I drive like once a month now, but it is more than that. And it's a big game changer for the body. So that's another thing. So variety, taking breaks, and driving less. Those are my best recommendations. You could also consider a lumbar support, but that's not going to be the solution. The solution is the variety. So taking that lumbar support in and out, put it in for 30 minutes, take it out for 30 minutes. It will help add to the variety. Oh yeah, there is a couple more things. Dang, I'm giving you the full answer. So the way that you're driving, connecting to your core, breathing, stuff like that. Another little trick that you can do is when you're holding the wheel and you're holding like the bottom of the wheel, you can just give a gentle pull towards you, and that can help you to activate your core, your abdominal muscles, and be breathing into your core and getting that expansion, that decompression, just with a little gentle core activation. So that steering wheel can be a little biofeedback tactile cue just to remember to activate that. And then the other, like, how you're driving advice is you can use the backrest of your seat and just kind of connect to that with your back anchor. So a little back anchor push away from your seat, and that can help. So the breathing is a really powerful thing for that. And everything else really in life. Breathing into your lower back is one of the most powerful things you can do. So hopefully that answer made up for accidentally skipping your question and then denying it. So that was double wrong on me. And let's see, here we are. This was you, Wes. And I think I'm still live. Am I still live? Do I still have people here? Let's see. Yeah, we still have people here. Wow. All right, guys. Thanks for sticking with me. We're at an hour and a half. Gene Bouchy also skipped. Okay. Where are we with Gene? Gene didn't call me out about it though. Yeah, here we are, how I skipped them. My PT has me stretch my IT band by crossing one leg over the other while lying down, but I thought crossing the center plane was bad for my SI joint. Yes, Gene, that is true. We don't need to stretch the IT band because it doesn't stretch. And two, all of that stretch is probably just going into your SI joint. So you are right. I don't like that stretch at all. There are way better ways to stretch if you wanted to stretch your TFL, because remember, we don't stretch the IT band. I don't like that technique. I don't like the idea of trying to stretch a tissue that doesn't stretch, and all that stress is probably going into your SI joint. So I'm confirming your thoughts there. All right, Kit B, thank you so much for everything you've been doing. You are very welcome, Kit. I'm a student of the CBT program. Best wishes to you. Thank you. Hey, I love comments like that. Appreciate that, Kit. JT Thompson, you're very welcome. Yes, I did post that before you talked about it, and I didn't think it posted. All right. Can you see me? Lisa, I can see you. Brilliant Pug. Hi. Hello, Brilliant. Vyam. Hi, Dr. Ryan. Started having right knee pain since I trained legs 3 days back after a year, or maybe I was doing the back anchor challenge too, which triggered it. But after I do bridges, it gets better. That's a great observation. I would do more bridges. Lisa Carroll. Oh, okay. I just wondered if I was connected. I've had so much trouble. I'm so sorry to hear that, Lisa, but you are here. I see you. I've been a student going on 3 weeks with all against me. I am now feeling it, the power of me again. Oh my gosh, I love seeing that. And this is the treadmill. I'm on the treadmill of chat. I'm going to try to catch up here. Vyam, also, when I try to rest my core and all my weight pressure goes to my hips and upper back, I feel real tight, almost painful in the buttocks, hip area. What do you think it is? It might just be like your body telling you it doesn't like that. And I don't really have like the ultimate knowledge about what's happening there, but it's just a theory of mine, because when you let go, when you disconnect, basically, when you try to rest your core, you disconnect from your anchors, which is a good thing. You're connecting your anchors is a good thing. When you disconnect and you go into that pressure going on to the other areas of your body's saying, I don't like that, reconnect. So it may just be communication from the body. And we want to stay connected and build up that endurance to be able to connect more continuously. Endurance, stamina, whatever you want to do it. Those muscles are designed for it, so you can stay connected for a long period of time. All right, Kevin says, keep going, good insight. I love it. Thank you guys for all the just positive feedback. And this is gonna be my last comment or question. I don't know if it's a question yet. Still here, thanks so much. I look forward to these live streams each week. I make them a priority to watch them. That's so good to hear. Thank you guys. Kevin and Indy, I appreciate you just giving me reaffirmation that the live streams are helpful. And Wes, I'm glad you were still here to see my answer. So yeah, you guys are all awesome. I love showing up and doing this every week. So I'm going to keep doing it. I'm going to keep doing it as long as I can. You know, the reality is, for those of you that are still here, I assume that you don't mind me continuing to talk. The reality is that I'm not going to do this forever. You know, I don't know that I'm going to be able to do this for the rest of my life. I might have another kid, and I might have things come up in my life where I can't do this anymore. So this is a a thing that I'm able to do now. You guys are here, and this is something that both of us appreciate at this time in our lives. And so, yeah, let's do this. Let's soak it up, and I'm gonna go as long as I can. I'll try to go as many years as I can doing this, but someday it may not be happening. And so I just want to appreciate the temporariness of all of this. I'm glad you guys are here during this. So yeah, thank you guys. You're the best. And no conclusion today because we've just been going for an hour and a half, and I'm going to just sign off for you. And I encourage you to go for a walk. Everybody go for a walk right now. I'm serious. I'm not joking. I'm going for a walk. Got to do this for my body. I've been sitting here for an hour and a half. I'm going for a walk. So until next week, everyone, get down on the floor and connect to your core. All right. Take care.